Both diet and exercise have undoubtedly had an enormous impact on the course of my multiple sclerosis. That said, there is one other key aspect that I investigated, and that's CCSVI. CCSVI stands for chronic cerebral spinal venous insufficiency. And more or less, that's just big words for blockages in the veins. Now, when this theory came out in 2008 by Dr. Paulo Zamboni, I thought it was preposterous. What could blood flow possibly have to do with multiple sclerosis? But my father did an incredible amount of research into this topic and encouraged me to investigate it. So I did. I read the papers that my father recommended, and I watched the YouTube testimonials and the written testimonials on the blogs from the people who had the liberation therapy all over the world. And what I saw was incredible. And I knew that this could not be ignored as the evidence mounted. So, in 2010, I flew to Poland and had my veins checked. With the Doppler, they discovered that this jugular vein was 100% blocked, and this jugular vein was 50% blocked. Well, when I saw that, I knew something had to be done, so I decided to have the venoplasty. At the time, I did not want to have the stents because I was worried they'd become dislodged or they'd clot and I'd have a stroke. So I decided to have just the venoplasty. Now, a venoplasty isn't some sort of graphic procedure where they cut open your neck and your jugular veins. What they do is they insert a tube or a catheter into your groin, up they go to the jugular vein, and with a tiny air balloon, open up the jugular. It's similar to an angioplasty, it's just a venoplasty. Well, once they did the procedure, the video afterwards conclusively showed that there was improved blood flow in both of my jugular veins. Now, the results of my procedure were nowhere near as dramatic as the ones you see online, because I was already doing so well from the diet and daily exercise regime. But I was experiencing some minor MS symptoms prior to the procedure. And that included difficulty sleeping, bouts of anxiety and depression, and strangely, I'd experienced nosebleeds throughout my entire life. After having the procedure, those symptoms went away. I slept through the night for the first time in decades, and the anxiety and depression lowered, and I also noticed that the nosebleeds went away. However, the benefits from the procedure only lasted for about 3 months for me, and slowly, those minor symptoms started to come back. But I was able to recognize when I was having blood flow problems and when I felt that there was a blockage in my vein. And what I do is excessive cardiovascular exercise to get my blood flowing and the oxygen back in my body. I have not had the procedure again, and I'm waiting for the research for CCSVI to continue. Once again, I am not a doctor, and I understand that CCSVI is a highly controversial topic because it flies in the face of current drug therapy for multiple sclerosis. But CCSVI research will continue, and I will continue to monitor it and take it very seriously as I treat my multiple sclerosis without the use of drugs. I encourage you to investigate it and keep an eye on it as well. So, 3 major strategies: diet, exercise, CCSVI. This is a drug-free approach to controlling your multiple sclerosis. This is MS Hope.